Hello and welcome to Moneycontrol. I'm your host Jerome Anthony and this is Reporter's Take. Although scientists are still looking for, or rather researching, for the vaccine of coronavirus in cancer treatment, there is a breakthrough. To tell you more about that, I have Moneycontrol's Vishwanath Pilla. Hi and welcome to the show, Vishi.
Hi, Jerome.
Vishwanath, so can you tell us what is this CAR T cell therapy and why is it called a breakthrough?
Yeah, so it's a very interesting breakthrough. So last week I've interviewed, Moneycontrol has interviewed Carl June, who is considered to be the pioneer in CAR T therapy, CAR T cell therapy. So if you look at it, what is CAR T cell therapy? So CAR T cell therapy is using our own immune system. Here immune system means T cells in this case, to fight the cancer, to fight and kill the cancer. So T cells are found to be very aggressive. They are like policemen in our body. They are always looking for any intruder like the viruses or bacteria, or else some of the rogue cancer cell, our own cells becoming cancerous for us, dangerous for us. So this policeman called T cell, he identifies them. But sometimes the cancer is too bigger for the T cell to it overwhelms the cancer cells, overwhelms the T cell. So in this case, this scientist Carl June, who is from US Navy, is a scientist come physician. He while doing his research, he found out that these T cells could be re-engineered, or it can be genetically modified to target the cancer cells in our body. So this treatment, this treatment was developed in his lab in University of Pennsylvania, and it was found to be hugely successful. So the Novartis, which is a Swiss drug maker, has licensed this therapy and named it as Kymriah. So CAR T therapy means chimeric antigen receptor T cell therapy. So Novartis licensed it and named it as Kymriah. Okay. So this is now been given to the children with certain type of leukemia, which is a blood cancer. Okay. And the cure rates are phenomenal. Like more than 80% of the patients who got this therapy have been so far their cancers have been in remission. Okay. So they haven't returned back.
What about the cost of this, Vishi?
So the cost is a major factor, limiting factor for this therapy. So it's not in India. It's not available in India right now. It is available in US and Europe and Japan, the most developed countries. So in US, it costs more than $1 million for the treatment. That includes the drug plus the hospital costs, as well. But only the drug, it's actually not a drug, it's a cell, it's a living cell given as a drug. This drug, the Kymriah of Novartis, they are selling it little less than $500,000. So it's only one shot, that's it. But Novartis defends saying that the drug is expensive because it is very customized. The person's own T cell has to be taken and it has to be re-engineered. It's like developing a vaccine. So something like of that scale. So it's highly complex, and it takes at least 2 weeks of time to develop this before it is injected back into the patient. Okay. So given the complexity involved in manufacturing, so the June told that 1/3 the selling price generally for a drug, the selling price is not even 5% of the, the manufacturing cost is not even 5% of the selling price. But here it's like 1/3 of the selling price. So the manufacturing costs are quite heavy. So that's one of the reasons why it's very expensive.
Okay, Vishi, anytime soon will we see this available in India?
So India, it's who can afford this, Jerome, frankly speaking, in India? Yeah, 500,000 and 1 million. So, but June says that, India has an opportunity here. And Chinese have realized a long time back, and they've invested $50 billion on developing CAR T therapies. So they're targeting many forms of cancer, including the solid tumors also. Uh, so, so there are around 300 trials that are going on in China. So they see that this as the future therapy, and they are preparing for it. So in India, frankly, not a single trial has been happening, or we haven't invested a penny. So the thing is that if countries like India and China jumps into this, the therapy becomes much cheaper because we have the manufacturing skills, we have the human resources, the cancer specialists, and it's much cheaper than developing a therapy in India compared to a Western country, I mean a developed country where the costs are humongous. June says that India has an opportunity here, so India needs to focus on it and try to figure out like how they can jump into it. So he says that this is not only useful for India, but it's useful for the world because India is a pharmacy hub. It supplies the much of the global need of vaccines. So it can similarly become a hub of CAR T cell manufacturing. So that is one. I mean, this small attempts that have started. Kiran Majumdar of Biocon, in our own personal capacity, is trying to jump into this CAR T cell therapy, and there's some bit of research happening in IIT Bombay and Tata Memorial. Both together are doing very nascent stages. So, but nothing much is happening in India as of now. So this is an opportunity that is there for taking.
Right, Vashi. Thank you so much for all these updates.